One.
Hi, this is Joyce Polino-Crane. I'm the news director at Westford Cat. I am here today with Julie Wysocki and Alison Christopher, and they're both here to talk about a new initiative in town, and it is to help our seniors and our elders in town. So Julie is a certified dementia practitioner and community relations manager for Senior Helpers. Julie, I've got my cheat sheet here. Senior Helpers is a home care agency based here in Westford.
Yes.
And Alison is the town's social worker, licensed social worker. Mm-hmm. She has her office in the Cameron Senior Center, and you are the social worker for the entire town, but you do a lot for the seniors, right, Alison?
That's correct. I like to.
So welcome to both of you, and let's get rolling with a little definition, Julie, for what a certified dementia practitioner is and what you do, because that is what you are.
Thank you. Thanks for having us here today, Joyce.
Happy to.
Being a dementia practitioner is actually my second occupation after caring for my own mother for 10 years with Alzheimer's disease. I was, at the end of that journey, was really interested in finding out how I could have done it better. By sharing the experience, could it help other people? And so I started working in the field of dementia or memory care in assisted living. And over time, a combination of education and experience, you can get certified through the National Organization of Certified Dementia Practitioners. And that's what I've been doing for the last 12 years.
Well, that's so interesting. Tell us a little bit about that journey you were on with your mom before she passed away.
Well, it is not unlike many other stories I've heard. We lost my dad suddenly and realized that Mom really couldn't live alone. He'd been covering a lot for her. And she came to live with us in my home in Westford. We were able to build a first floor ensuite for her, but really all of my children and family and friends helped share in her care. And I feel my children learned lessons of love and humility I never could have taught them. I think they're better people for having cared for their grandmother. And the street, Mark Vincent Drive, where we lived, really became a dementia-friendly street, that everyone knew my mom. They knew her challenges, our challenges, and I had her for 10 years. So
it's a long time.
It was quite a journey.
And they all looked out for her, it sounds like.
They really did.
Mm-hmm.
They really did, and would offer to come, help feed her lunch if I had to go out, or a dinner. It was really some wonderful people.
So Alison, tell us a little bit about the role you play as a social worker for people with dementia.
Sure. So as the social worker at the senior center, a lot of the residents who are newly diagnosed with dementia, as well as their family members and caregivers who may already be caring for someone with dementia, they know that this resource exists for them to get assistance, support, guidance, referrals for necessary help to get through this phase of their lives. And it can be a very long phase. As Julie had said about her mom's illness, many people with dementia live for 10 or more years with the disease. So I tend to get calls from people who want to sit down and go over what things they may need to change in their household or in the way that they do things with their loved one who's been diagnosed. perhaps if someone's living alone, I'm getting calls from other members of the community who are concerned for someone that they know and who have seen changes in that person. They reach out to the senior center knowing that both I and our outreach worker, Annette Cerullo, have had the experience for many years in other settings working with people who have dementia and who need treatment for symptoms related to dementia, and that we can offer them guidance and support and compassion just in coping with the caregiver needs that they may have.
So if I am shopping in Market Basket and I see someone who looks confused, what do I do?
So there are different things that people do in that circumstance depending upon how the person looks confused. So I've had circumstances where they may bring it to the attention of the manager of the store, and then the manager of the store actually knows people at the senior center, and they may call over to us and say, we had an experience with this person in our store and we think that they could use your help. Or perhaps the person has ridden to Market Basket on the senior center van. I've had experiences where someone will notice someone having difficulty paying at the register and will, in the moment, help them to get through that transaction, but will also pass the word on through our van driver that this person is seeming different this week and someone should look in on that. So I think as a citizen, a lot of what we are trying to do with this Dementia Friendly Westford initiative is to give everyone in town, citizens, people who are out and about on the street and stores, the tools to know how you might interact with someone in that circumstance, how to speak to someone who has dementia in a way that's non-threatening, in a way that can help to comfort them and not increase their anxiety. Coming at them from the front in a gentle voice and introducing yourself and asking if they could use a little help right now. So this is something that is not easy to describe in a brief interview, but something that over time we hope that people will develop the tools based on what this program of the Dementia Friendly Initiative is able to offer to a community.
Okay. Julie, do you have something to add to that?
Well, it's Alison raises some very good points in that you can't see dementia, but very often safety awareness is severely compromised in someone with dementia, much like that of a child, although these are dignified adults. They're struggling very hard to present properly and do the right things, but their decision making and safety awareness puts them at risk, especially in extreme weather conditions. If someone were to go out today in a wool coat, dehydration would be a serious problem. Or to go out in the colder temperatures without a jacket. They actually don't even know to look both ways to cross the street. It's that type of safety awareness and lack thereof that really puts them at risk. So if 6 out of 10 people with cognitive impairment wander, and we had 6 out of 10 Westford residents that knew the signs, that knew how to help redirect or reassure or console, what a much safer place this would be.
Absolutely. And you've already started recruiting leaders in the community. Is that correct?
We have. We kind of collaborated on, through our connections, people that we felt would be a good representation of the different sectors in town.
Such as business, what other sectors?
Government, religious sectors.
We have Gail Johnson, our town nurse here in Westford, on board, Nancy Burns from the Merrimack Valley Reserve Corps, John Healy from the oil company, which we find often gets red flags for seniors at safety risk.
Detective Nicoletti, the elder officer,
So about 25 people in town.
Did you say there's a hairdresser also now?
Yes, Camilla at InStyle.
I thought that was very interesting because that's an intimate service that hairdressers provide, a very intimate service. So they are up close.
They really are. And actually, each time I have been there, I almost always give out my business card from senior helpers that someone is talking about a challenging situation with a family member or expressing concern for a neighbor, and don't always know what the resources are, how they can help. So this initiative will hopefully be widespread, and it's really very broad in vision. When public safety decided we're going to put curb cuts in all the sidewalks to make them handicap accessible. Well, what it ended up doing also was being user-friendly for anyone pushing a stroller, anyone riding a bicycle. So dementia friendly is very much that same broad vision, in that by creating this, we're going to create a very friendly, well-informed, safer community for the growing, aging population, which we talked about some of the numbers. This is 300.
Can you
Go ahead, Allison.
Yeah, give us some numbers.
Well, you have the statistics on your paper.
Well, there's only a
well, I have my cheat sheet here.
300 people difference between people over 60 and people under 18 currently in the town of Westford.
So, what do you mean by only 300?
Well, there's
difference?
over 5,000 children under 18 in town, and 4,700 people, residents over 60.
Is that right?
Right. So there's a lot of, and the reason we wanted to look at this, because Marlborough, Northborough, and Hudson, who launched a Tri-Town Dementia Friendly Initiative last year, have announced that their population of citizens will actually have more citizens over 60 than under 18 in the town, in those three towns.
That's remarkable, but the boomers are getting older.
That's right.
And guess who I am?
Hey, I'm in the club with you, Joyce. But it is, the numbers are staggering, and unfortunately, with someone being diagnosed with dementia every 66 seconds, they're saying it really is an epidemic. In the combination of the population living longer, the boomers, and the diagnosis and cognitive impairments that we're seeing.
Yeah, it's not a laughing matter, really.
It is not.
When, what are the physical changes that occur in the brain when dementia or Alzheimer's occurs? Can either of you address that kind of in layman's terms?
It's a little bit tricky because dementia is kind of an overarching term that describes a lot of different syndromes that cause the cognitive loss. So depending upon the type of dementia that someone has, you see different changes in the brain. So it is a bit of a tricky question. I guess what I would say is whether it's the thought that perhaps plaques and tangles cause Alzheimer's disease, or that vascular changes resulting from other health issues causes vascular dementia, or that Parkinson's disease and Lewy bodies in the brain causes a different type of dementia. The bottom line is that they're all causing a deterioration of brain functioning. Most of the diseases as a common element have memory loss as a significant component. You know, some have language and spatial awareness issues as being more primary. Others have, judgment and insight issues as being more primary. But I don't think that the general population really needs to know the details of that. I think they need to know how they might identify someone that is struggling with some kind of dementia, and to just know how to be empathic and compassionate and interact with that person in a respectful way, and how to get help for them if help is needed.
So the initiative, Julie, has 4 phases to it?
Yes.
And this is phase 1. So define for us the 4 phases.
Well, it's Dementia Friendly Massachusetts actually took place a summit in Boston last spring. And that's kind of spearheaded dementia-friendly communities that are now growing throughout the state. We do have over 120,000 residents currently in the state of Massachusetts with dementia. They are projecting 150 over the next 15 years. I think the numbers are important just to help people understand that because this is being called an epidemic, that the more people that know or have the basic knowledge, and we're not looking for people to become dementia practitioners. This is a very user-friendly, simple communication tips, and eventually perhaps a dementia registry, a resource hotline right here in Westford.
So wait, so we're in phase 1, so what would phase 2 be?
We would be convening people, these sector leaders.
Which you're having that happen in September, correct?
We are. We have the date.
September 28th.
Yes.
At 2 p.m.
And
NetScout
has
on
offered
Route
to host
110. Okay, so that's the gathering of the sector
Yes.
leaders. Okay, and how many are there in total?
Right now we have around 20 to 25, but there may be more, and we're hoping people that see this announcement, those past and present caregivers, will step forward because we really need their guidance and advice on designing these dementia-friendly practices.
So if somebody's interested in becoming a sector leader, how would they get in touch with you?
And sector leader almost sounds scary. It really is just, that's a term that they put in the dementia-friendly toolkit.
Okay.
It's more like a representative, of a group.
Yeah,
it
a
could be more than
volunteer.
one person. Yeah.
Yeah.
And it was
Okay,
actually
that's nicer. Yeah.
In an interview that I saw you do with one of our top mentors and volunteers here in Westford, Ellen Harding, said
Ellen
that,
Hardy?
Yeah, Ellen Hardy, excuse me. She said that Westford is known for a community rich with volunteers who are compassionate and dedicated to community causes. And I thought, we can do this. We could do
Yes.
this here in Westford.
That's spot on. Yeah.
It really
So
inspired
that gave
me.
you the idea.
It really did.
Ellen's words, and so now you're here and you're into phase 1, and you've got phase 2 planned. And if people want to volunteer, how would they get in touch with you?
Either Alison or I, and I think you'll have both websites.
So yeah, there's seniorhelpers.com and westfordma.gov for Alison, and Julia seniorhelpers.com. And on those websites, there are opportunities to find the email for both of you. Is that
Yes.
correct?
Or the
Yes.
phone number.
Or the phone number. So we'll,
Yeah.
yeah.
And then after the convening process, we'll kind of talk about and assess the needs of the communities, what our priorities are, where you need to start. Again, this isn't going to be a quick fix. It's over time. And hopefully we'll be having community trainings. There's something called a virtual dementia tour.
Now, is that phase 3?
2 and 3.
Kind of a transition.
Transition, kind of
Yeah.
analyzing, setting priorities and goals, and then actually creating the trainings and educations across the board.
So formally, what is phase 3 and what is phase 4?
To convene, engage, prioritize, and then a way to measure the progress.
Okay. So where do you foresee this program or this initiative? Where do you see it in, maybe 5 years from now?
Well, I think that's why we've
Yeah.
collected 25 brains, because I think 25 are better than 5 and definitely better than just 2. Getting the input. We really need the input from other leaders in the community, what they're seeing. People that are living with this every day, what their needs are. Is the number one thing the checkout at Market Basket? Is it at the bank? Where are they seeing the biggest struggles and challenges in town? Even Holly at the Fletcher Library is on board.
Yes.
That's a very important sector. People they're living with this disease a very long time.
Yes, yeah.
And that really, people need to know that it's not a 2-year sentence, terminal. It's a terminal illness, but they can live a very long time and can still have a very vibrant life. And I find it very rewarding to be a part of that. And I think the education can be very empowering to support people that are caring for loved ones. It's a long journey.
Yes, and I have a family relative who has been living with Alzheimer's for more than a decade now, and her husband has been taking care of her for all these years with help that comes in. It's just a very difficult situation.
It is.
But you're right that they can live a vibrant life, and,
Yes.
and that is gratifying to see. Alison, can you tell us a little bit about the facilities in town that care for these patients, or are they? Is patient the right word?
I don't think so. I mean, I would describe them as people who are living with dementia, because many times they're not a patient. Many times they're someone who's out living in the community, and when they go to the doctor's office once a month or every 3 months, they're a patient there. Mm-hmm. But in our community, these are just kind of people living their lives, and they happen to have this particular diagnosis, which is or can be very tough to live with. But I definitely don't think of them as patients, because when I see them, that's not the role that they're in. And I think when a lot of these community members or sector members see them, that's also not the role that they're in. So, when Julie mentioned Holly at the library, there are people who may not have even been diagnosed with the dementia yet, but who are showing changes, and people at the library or people in the tax collector's office at the town hall are the people who are in contact with these people when I am not, when perhaps even their doctor is not, because they're the first people seeing things shift. That this person has come in and asked about their tax bill now 4 times, and that is not like them. Or someone comes into the library and gets agitated over something very simple that is not the way their personality is. Those are calls that I've gotten, specifically those examples are things that have happened where we've identified people that are, newly struggling with cognitive loss and needed things to change in their life that maybe I wouldn't have known about, maybe their family wouldn't have recognized in the visits that they had with them intermittently. So yes, we do have facilities in town for once someone may need to move from their home and be cared for in a memory care assisted living like Bridges of Epic, or Westford House, which has a dementia or memory care unit within it. But there are also caregiver support groups for people with dementia in town. There's one at the senior center. There is Project Lifesaver, that people can wear a bracelet when they're still living at home, and if they were to wander off, the police have a system for helping to find them. So it's not just facilities, it's facilities and home-based and community-based programs that already exist.
And you also have other services for seniors at the senior center, like a van to transport them. Where can they go in that van?
So yeah, I think the van is such an important service for seniors who, because of physical or cognitive issues, have become unable to drive. Such a huge loss of independence for seniors. So the van is able to go really anywhere within Westford. It also goes to Concord, to Littleton, to Groton, to Ayr. There are many of the surrounding towns that it goes to, and it can take people to their doctor's appointments, to go swim in a pool. We have clients that do that, to family members' houses.
Getting their hair done.
To get their hair done, which is
so
very important.
Very important.
It is very important.
It matters. My mother is elderly, and that is the thing she lives for every week, is to have her hair done.
Oh,
We do a grocery
my mother
run.
loved that. Yeah.
Yeah, I mean, shopping, taking people not just to Market Basket every week in big groups, but to their pharmacy to get their medications. We really want the van program to support people maintaining as much independence as they can have within getting around and being mobile.
That's a request we get also at Senior Helpers, is we have several clients in town that may just need, you know, 5 or 6 hours. They need meal prep. They want a ride to go grocery shopping, pay their bills, make a doctor's appointment, help with some light meal prep, and making sure there's no science experiment in the back of the fridge.
Oh yeah.
And put the fresh.
Nice way to put it, Julie.
You know, and it's a need, and it's nice to be able to fill that need, whether it be once a week or 2 or 3 times a week, but making sure, you know, our caregivers have the driving clean and 3 record is very important, because it is a need that we get a lot of requests for.
Yes, and it also gives companionship.
Yes, yes.
Which, you know, takes away some of that isolation and loneliness, which is always a concern.
And Alzheimer's by itself can be very self-isolating, because they have that trouble navigating, what is it, where am I supposed to be? What am I supposed to do next? And their nutrition can often suffer, and all the other issues that we've been talking about, because they're afraid to go out to find out what the challenges might be out there. So.
Yeah.
And I even hear from spouses who are caregivers that a lot of the friends that they've done things with just don't know how to interact or feel comfortable interacting with their spouse anymore. So they get isolated as well, because they don't feel that they can go out as couples with their couple friends in the same way. And you know, one of the most important things with dementia is keeping people engaged and keeping their minds as active as they can be to stay on the most positive track that they can be on. So I think even more important for maintaining the connections within the community when people have this illness.
We only have a couple of minutes left, and I just wanted to make sure we've covered all of the points that you want to cover for this initiative, to let the community know what is coming down the pike and how they can get involved.
Well, I really appreciate the opportunity to collaborate with the Senior Center and get the word out there. And I recently did get a tip on good brain health from Teepa Snow, who is a dementia specialist, is to stop, set your phone 3 to 5 times a day and take 3 really deep breaths. In through the nose, out through the mouth.
I always forget to do that.
And
That is
well, we're not good breathers,
advice.
especially baby
Right.
boomers. The brain needs that extra oxygen for clarity. So
I'm thinking
keep
about
breathing.
it now. Well, and also it's great for mindfulness, because if you're thinking
is.
about your breathing, that's what you're focused on.
Yeah.
So
I'm sure I'm overdue for one of my reminders on my phone.
going to put them on my phone now too.
Yeah.
That's a really great idea. Allison, anything you want to say to wrap this up with?
I think just to let the folks know who may have been diagnosed with dementia and their care partners, whether they be adult children or spouses or friends or other loved ones, that they're welcome to participate in this initiative, and we really need them to participate. So we hope that they'll reach out and let us know that they're there and that they want to be a part of this discussion, so that when we're having this first brainstorming session, we can use the information that they have that's so valuable about what they experience day to day.
Thank you so much. Thank you, Julie. Thank you, Allison, for coming here today and for sharing this interesting topic with us. And I would like to say now to the community of Westford, get involved, and I will see you around town. For Westford Cat, this is Joyce Polino Crane.